Hello everyone, Dr. Sean Doran here, local medical director with SWORBHP. Just wanted to wish everyone a happy Paramedic Services Week. Wanted to thank you all for your hard work, your dedication to our patients and to the regions that we serve each and every day and each and every shift. So once again, thank you very much, and hopefully you get the recognition you deserve this week, which is a lot. Okay, take care.
Our service is certified to use the treat and discharge medical directives. I find it much easier to complete a refusal of service for all patients that I'm not transporting to the hospital since I've been doing this for many years. Why would I use the treat and discharge directives if I can just as easily do a refusal of service?
That's a really good question, actually. There's a significant difference between a treat and discharge medical directive and a refusal of service. The key component of that would be the liability and the legality issues surrounding that. With a treat and discharge medical directive, there are specific indications and contraindications where that directive applies and allows the paramedic to make the decision if they meet that directive to discharge the patient from 911 care. However, with a refusal of service, you have a bit of a different situation where the patient is refusing transport to the hospital or service by the paramedics, despite the paramedics recognizing that the patient may actually need that care, but the patient is competent to make the decision to refuse the service, in which case the document is signed to have a refusal of service situation. The key component is where the liability lies. With the treat and discharge medical directive, the liability lies with the delegating physician via the directive being an offline control issue, but the liability is to the delegating physician. Whereas in a refusal of service situation, the liability of determining competency and then ultimately whether the refusal of service can be granted or not really lies with the paramedic. So very different sort of components to that, but important to think about that when considering a refusal of service situation. And one final issue to consider with refusal of services is that we've noticed at some points in time a bit of a trend where refusal of services seem to be somewhat encouraged. We know this more anecdotally by reports from physicians receiving hospital and so on and so forth, or from the patients themselves, where they felt that perhaps the treating paramedics were somewhat encouraging them to not go to hospital, and then when they agree to that, then signing refusal of service. I believe there's been some education about that, at least at some of our services, which has been very, very helpful, and is something that we strongly discourage. But I also note that seems to have anecdotally decreased quite a bit in the last month or two, which is excellent. But please just keep in mind that with a refusal of service situation, you want to be very certain that the patient is competent, or their power of attorney for medical care is competent, and that they truly want the refusal of service and don't feel like they've been sort of encouraged to choose that option, because that has come up a few times, and then in that situation the liability for any potential harm falls back onto the paramedic and becomes a very sort of potentially challenging situation. Anyhow, so that's just a little discussion about treat and discharge directives and refusal of services, some of the differences. I'm happy to take any more questions or discuss the topic further if you wish to. Please just reach out to us here at SWORBHP, and we're always available and always willing to chat. Okay, again, enjoy the week. You guys deserve it. You do some really good work out there, so take care.